on to questions after we review the fee report.
We can have the questions after that.
Great.
Thank you. Thank you.
LNC statute requires that LNC publish a list of estimated fees and a fee report by February 1st of each year. Based on statutory requirements, LNC begins by projecting the mandated workload by facility type, allocating the LNC program special fund appropriation authority against each facility type's workload percentage, then applying the regulated credit and dividing the amounts by the associated facility type of counts of licensed facilities or licensed beds. Regulated credits are defined by law as 95% of amounts actually received for new licensure applications, including change of ownership applications and late payment penalties. The regulated credit that we used this year was $3.7 million. These initial calculations result in some facility types with significant fee increases and other facility types fees with significant fee decreases. To avoid this large fleet fluctuation that would result from our initial calculations, LNC applies additional credits from our LNC Special Fund Reserve. For fiscal year 14-15, LNC applied $11.6 million in credits from the LNC Special Fund Reserve so that facility types for which the initial fee calculations would have produced a fee increase, we have maintained fees at fiscal year 13-14 levels. 3 provider types, the home health agencies, hospice, and referral agencies, will have decreased fees of 20% from fiscal year 13-14 levels. Applying credits from the LNC Special Fund Reserve also helps LNC to gradually reduce the fund reserve to 5%. The facility fee chart is found on page 8 of the fee report. We also have the nursing home administrator program fees. Statute requires LNC to adjust and have fees based on program costs. For fiscal year 14-15, LNC estimated the total program cost at $613,000 based on projected expenditures adjusted for changes in staffing levels. LNC applied a credit of $229,672 from program reserves to keep fees at an 8% increase. This approach will align the fee revenues to program costs in approximately 7 years. That concludes the fee part.
Thank you very much. Department of Finance, LAO, any comments? Thank you.
Amber DG with the Legislative Analyst's Office. We concur with the concerns raised by the committee staff in the agenda regarding the LNC estimate, and we agree with the need to identify shorter-term solutions to these issues.
Thank you very much. Department of Finance now. I have a question regarding the charts that are on page 32. Can you provide some information to us as to how many of these cases are being investigated in a timely manner? In other words, within that 10-day period that is required? This doesn't really elucidate that.
Are you asking us for the percentage of cases? There's a state mandate that we initiate a complaint within 10 working days by conducting an on-site visit to the skilled nursing facility?
Yes.
Scott, did you have that number? I believe it's over 90%.
Yes, we are initiating approximately 98% of the immediate, or I'm sorry, 98% of all long-term care facilities within our 10-day statutory mandate.
So you are responding within 10 days, 98% of all complaints within each quarter?
For initiation, yes.
For initiation, what does that mean, initiation?
Initiation means that once we receive a complaint from a complainant, family member, whomever else might be, it is triaged, it is assigned a priority, a surveyor is assigned to do the investigation, and the investigator will leave our office and go to the facility and begin the gathering of facts, interviews, to initiate that component of the investigation.
So the investigations begin, 98% investigations begin or are assigned somewhere?
No, they actually begin with foot in the door, so we start gathering the information. Yes, they begin.
Okay.
The requirement is they must go on site within 10 working days to begin their investigation.
So they begin the investigation.
Yes, which means they must go there, they must, again, determine what has occurred, speak, of course, to the resident if that's appropriate, and to the facility, investigate the specific situation.
And then is the information that they start to receive within that first 10 days, is that shared somehow, or is that ongoing? In other words, they begin 98% within 10 days. Is there some sort of information shared or resolution, or if there's a problem, it's brought to someone's attention within that 10 days, or is this an ongoing process?
It's an ongoing process. Some complaint investigations take longer to investigate. Some can be resolved fairly quickly. So we initiate within 10 days, and we're not satisfied until we've conducted all of our interviews, all of our observations, all of our record reviews. And that might take a measure of time beyond the 10 days so that we have a thorough understanding of what took place, and we can appropriately determine if there's a violation of regulations.
Okay. And then the charts indicate that there is maybe about 50% of cases that are closed within 60 days? Is that what these charts show?
Yes, ma'am.
Within each quarter?
This is on an annual basis, so what we have presented to you was...
Skilled nursing facilities I'm looking at right now.
You're referring to page 32,
Yes.
correct?
Yes. Yes, sorry. I know there's more than one chart. Yes. Page 32. I'm looking at the skilled nursing facility complaint summary.
Yes.
Okay. All right. Thank you. Public comments?
Beth Capel, changing topics and thus changing clients on behalf of the nurses and the other health professionals of AFSCME. The information that's here, which is partial, we are deeply concerned that they are not closing complaints with respect to hospital complaints within the statutorily required 45 days. This only speaks to non-deemed hospitals. Most hospitals have deemed status. We are also deeply troubled that the department continues to fail to enforce state law. This is something that has been an issue that we have raised repeatedly for many years, and specifically that they do not monitor for compliance with the nurse ratios and with other staffing requirements that are in state law. Law enacted in 2006 requires them to do so, and they have, to the best of our knowledge, not yet done so. Your committee analysis and our conversations with your staff indicate that it is not possible to determine in what way they are monitoring for compliance with state law. Our focus is particularly on hospitals. I would note, however, from prior experience that these concerns probably also apply to nursing homes. Thank you.
Thank you.
May I point out some facts that basically relate to explain the type of work that we're doing for enforcement under state law. As we pointed out earlier, we do monitor to ensure that we initiate the facility complaints within 10 working days. We also, when we do conduct federal complaint surveys, we use a dual enforcement process in which we take the information collected during that federal process and also write that up under state law. So deficiencies under state law that are identified that are in excess or different than those under federal law are written up under state law. As you know, under state authority, we investigate adverse events and breaches of medical records, and we issue administrative penalties. We also do conduct staffing audits in response to a complaint. I want to make sure that I'm very clear.
And I want to be very clear
We want
as
to
well.
both be very clear on that. We also do conduct medical error reduction plan reviews at hospitals in California, as well as patient safety licensing surveys.
So, if I might, Madam Chair, just to be very specific here, what our assertion is that during the routine surveys of hospitals, they do not seek to monitor for compliance with staffing ratios. If there is a complaint or if they inadvertently, during the course of a federal survey, stumble over noncompliance with the ratios, they will then enforce, but they do not routinely monitor hospitals for compliance with those staffing requirements, or indeed the many other staffing requirements which are specific to our California regulations. And it was only recently that the department adopted penalties for violations of the ratios, authority they've had for, again, a number of years now. Thank you.
Thank you very much.
Good afternoon again, Madam Chair. Randy Cheek with SEIU Local 1000. Local 1000 represents more than 8,000 medical personnel in state service in California and has some concerns with the governor's budget proposals to cut funding to California's Department of Public Health. CDPH provides licensing and certification to nursing homes, ensures adherence to state and federal regulations, and investigates complaints that are deemed a threat to the health and safety of patients. Local 1000 believes that cutting funds to CDPH, an already troubled department riddled with issues, creates several difficulties for staff to perform their duties. Short staffing is one issue that has created a huge backlog, which in turn has impacted the department's ability to function properly. The ability to finalize and process paperwork for unsubstantiated complaints has been directly impacted by the staffing shortage and exacerbated by the state's reduction in funding for this. Nurses at CDPH are underpaid, overworked, short-staffed, and often required to leave their families for weeks at a time. Funding cuts to a department that already has significant problems not only poses a threat to public safety, but also could be a matter of life and death for some patients. SEIU Local 1000 asks you to reevaluate these cuts and restore funding to CDPH and protect the most vulnerable populations of our community. Thank you.
Thank you.
Madam Chair and members, Michelle Cabrera with SEIU California. We represent both the state workers and LA County's licensing and certification nurses and staff. I want to thank your staff and the committee for your attention to this important patient safety matter. In bad budget times, the state did make difficult decisions about staffing, both through freezes on staff hiring and furloughs. These have had impacts that have reverberated through the system, and particularly not just in direct service programs, which we hear a lot about, but also on these sorts of vital state regulatory functions. While programs like this one are fee-supported, as your analysis points out, we have serious concerns about the disconnect between the challenges faced by our workers, the licensing and certification staff at both the state and the county level, and the proposal or the concept of crediting back facilities. We're heartened to hear that the department does acknowledge that the formulas that are in place right now are flawed. We don't think that fixing these problems can or should wait until the end of the fiscal year. And finally, let me just say that it seems as though the worker perspective is missing in any evaluation or assessment, not in its entirety, but just that workers should be central. They're the ones that have to deal day in and day out with, living the workload, understanding what kinds of state and federal mandate pressures they're under. And we know that short staffing is at the heart of this problem and the solution. And so we look forward to working with both the department and your staff on making sure that their perspective is understood.
Thank you very much. I have a couple of questions. Obviously, some very serious issues have been raised, both by the public testimony and the comments in the briefing materials that were provided to you and to us. So I'd like to go back and ask a question that was raised in the public comments. Can you just give us some very specifics on what steps the department, DPH, is taking to monitor the enforcement of state laws? I'd like some specific answers to that.
Certainly. Thank you. The program has put into place a longer-term solution to address the issues within the field operations branch of licensing and certification. That long-term plan involves the current work that was undertaken beginning at the end of August of 2013 by bringing on a consultant. That consultant was really tasked with providing a program evaluation. And that evaluation is not limited just to federal workload, but it was also includes state workload and the entire field operations itself, which I think is an important point. We want to make sure that we're not differentiating. We are looking at workload, for instance, if it's federal or state, to make sure that we're doing what we're supposed to be mandated to do. But this evaluation really basically looks at the entire assessment of the program itself, then a gap analysis, and then recommendations and a remediation plan. And the next step after that is we'll go through as a part of one of the BCPs. But clearly we are very disappointed in the fact that we really have such significant flaws in our system. It's embarrassing and disappointing, and it should not have taken place, but our estimate is flawed. And so we clearly recognize that. So we're not waiting for this evaluation, which will conclude in June of this year. We believe it's really critical that, based upon the fact that we've seen what we've seen and the feedback that we have and the problems we have initiated and accelerated our work to go ahead and address these things. So I'd like to review with you some of the things that we have done. I want to make sure that you understand that we're taking it seriously and we're not waiting for a report.
So excuse me just for a second. So in these comments, you'll also address the concerns with regard to the LNC program as well, the question that we asked.
Yes, I'd be more than happy to do
that. Okay, please. So within these remarks.
Right.
Okay,
thank you. No,
thank you very much.
So basically, I wanted to just let you know that we are moving forward. We have accelerated the scope of work that we're developing to look at the timekeeping system. As you heard Maria Gutierrez explain, the base for the estimate and for the fee is the timekeeping system. So I'll just, I'm a surveyor, for example, and I do perform federal work, and I also perform state work. And sometimes I go to a training, for example. So on a daily basis, I need to track exactly where those hours should be allocated. And we have, until we know that we have investigated that component of the timekeeping system, we will, if we find that they are entering correctly and things are moving along very, very well, we will look more in depth to the actual timekeeping system itself. But our initial activity is to put into place a plan beginning on 7/1 to slightly modify the timekeeping system to make it easier to use. Currently, they require that the nurse enter the information, or surveyor nurse enter the information monthly. We're going to have them enter it weekly. We're also going to have enforced supervisors sign off on that so that we're really sure that we're capturing correct information. We'll also be setting up a monitoring program. And we will, at the same time, proceed with the development of a scope of work to have someone look more thoroughly at the overall timekeeping system to make sure that we are on track. Another area of hearings that we've had have concerned the professional certification branch, which is in licensing and certification. This particular branch investigates complaints and allegations for CNAs, certified nurse assistants, home health aides, and hemodialysis technicians. We have a significant backlog of cases in that particular area, so we are bringing on a consultant to do a business process improvement, but on it thus far, we've already initiated a review of their systems and tracking systems, made some corrections to that, so we're now getting very accurate reports. We have also completed an entire workflow, their process workflow, and are now having them time tracking all of the work that they're doing. We are developing performance metrics and dashboards to help us manage our complaint workload, whether that be with licensing and certification, looking at facilities, or also the complaint workload that we're doing when we look at the complaints associated just with the professionals. We are updating our databases to ensure that our surveys and our investigations are properly closed in the system so that our data will be far more accurate. So we don't see this as we believe it's important that we move forward now. We know the evaluation will come out in June, but from that point on, we need to move forward now. This is obvious. We need to use our resources and begin to address the more significant issues. I see us needing to resolve a number of infrastructure and business process systems within licensing and certification. So we know that the two programs and efforts that I've just described are not sufficient. So basically what I'd like to do is basically turn to HQ01, which is the overview of the proposal that we have. We are asking for, we're on page 6, I don't know what page.
34 for
34?
us.
Okay. I'm on my page 6, which is not the same thing as your page. So basically, we're asking for $1.4 million from the internal departmental quality improvement account. That account was established when the legislature tasked the licensing and certification program with the authority to go ahead and issue administrative penalties that rose to the level of an immediate jeopardy in state law. There are many adverse events that are reported to us from our hospitals, and many of those have resulted in administrative penalties. The mandate also states that the amount of money in this particular account can only be used to improve the operations of the licensing and certification program. The goal of this particular request is to improve our internal business practices and our timely completion of LNC state and federal certification workload, not limited to complaints, but the entire workload. We also know that when we address this for the federal government, we can ensure not only sustaining our current funding from the Center for Medicare and Medi-Cal Services, but also an increase in our federal grant. If you'd like me, and we do have some recommendations and areas, and we have some scopes that we've already identified that we'll be using the $1.4 million to address. Those include, of course, looking at our workload assignments and the way we manage our workload. We definitely have some system and technology issues that make it incredibly difficult to track that workload. We also need to look at the allocation of staff and our funding resources. We need to certainly look at the time entry and tracking system that I just described, which is, again, the basis for the information we use for the estimate and fee report. We need to look at program efficiencies, and there are many, many things that we need to address.
Thank you very much. And I know you're addressing a lot of the long-term issues. We're hoping to also work with you on some of the short-term concerns as well.
Absolutely.
Will you work with us on that?
Thank you.
Okay. Thank you very much. Senator Monning, do you have any questions? Okay. Very good. Yes. Any comments from Department of Finance, LAO? I know we asked a little earlier. Any additional comments? All right. Thank you very much. We have been having public comments. Any additional public comments? Please come forward.
Hi, Michelle Cabrera with SEIU again, Madam Chair and members. Just wanted to say on this item that reiterate our plea to include the workers not just as the subjects of this evaluation, but as crucial subject matter experts. So thank you again for your attention.
Thank you very much. All right. This item we will also be holding open, so thank you very much. We look forward to working with you on this. Yes, so we're following along. We're now on item number 5. Thank you very much for your presentation. Licensing standards for chronic dialysis clinics, rehabilitation clinics, and surgical clinics.
It is us.
Yes, yes, I was wondering.
Wait.
According to this, it's you. Please don't go away yet. All right, welcome again.
Thank you. You threw me off my game a little bit. Okay. So this proposal.
Thank you.
This proposal requests a one-time expenditure authority of $201,000 from our internal Department of Quality Improvement account to contract with the University of California, Davis to assess the sufficiency of using federal certification standards as a basis for state licensing standards for chronic dialysis clinics, rehabilitation clinics, and surgical clinics. The goal of this proposal is to determine if the federal certification standards for these facility types are sufficient to serve as a basis for our licensing standards. LNC program licenses approximately 30 different facility types, including the 3 that I just mentioned. Senate Bill 534 authorized the department to use the federal certification standards to meet our licensing standards for a period of 4 years while we determine the efficacy of using those federal standards for our state licensing purposes. The assessment will be conducted to look at a literature review, peer reviews of regulations to determine whether or not they are sufficient for our licensing purposes. The bill required at least one public hearing that we will conduct, and that we deliver a report to the legislature by July 1, 2017.
There it goes. Thank you very much. Any comments from Department of Finance or LAO on this particular presentation? All right, thank you very much. Public comment on this item? We are recommending that this item continue to stay open so we can continue discussion on it. All right, next item is oversight of nursing home referrals to community-based services. Welcome again. I know you have some items to respond to in our agenda. Item 6 on ours.
Yeah, sorry, Jean.
Jean Icino, Interim Deputy Director, Madam Chair and Member. So we're talking the MDS Section Q report.
Yes.
In October of 2010, all Medicare and Medicaid certified nursing facilities began to be required to use the MDS data set. And this was intended to place an emphasis on the individuals in a facility participating in their assessment and goal setting. So MDS Section Q allows individuals to express an interest in learning more about the possibilities for living outside of the nursing facility.
Yes.
It's designed to identify each resident's goals and expectations relating to whether they stay in the nursing home or transition to other living situations. Nursing facilities are required to initiate a referral to a state-designated local contact agency to provide the resident with information and explore potentials for returning to the community if the resident expresses that interest. As the state Medicaid agency, the Department of Healthcare Services is responsible for maintaining that list of local contact agencies. And then the local contact agencies are responsible for keeping data on nursing facility referrals and providing information and education to individuals who have indicated a desire to speak with someone about home or community-based living options. The analysis requested an update on the status of the legislative report. The report is being revised based on feedback and questions from our agencies. CDPH and the Department of Healthcare Services are joint authors of this report, and when the report is finalized, it will be released from the Department of Healthcare Services. There was also a question about what the administration does to ensure that nursing facilities make the appropriate referrals to local contact agencies. As part of the survey process conducted by LNC, our surveyors, when they are on site at a facility, review the Section Q data for surveyed residents or residents that are part of the other survey items, to determine whether or not the facility has addressed the federal regulations and engaged them in this process. However, it is important to note that residents may decline to participate in Section Q activities and provide that information. If one of our surveyors finds that a facility has not complied with Section Q requirements, that finding will appear as a deficiency in the survey report.